Welcome to a very special edition of Medical News Network, your trusted source for the latest in medical and dental information. I'm Mike Wittgenstein, and thanks for joining us. We've had a very special opportunity today to bring our cameras back to the office of a doctor we first interviewed in studio a few years ago to find out what's new in dental implants, what's changed, what has technology done, what can be done now that maybe couldn't be done a few years ago. And between you and I think you're going to be amazed. So if you'd like to be better educated, find out if maybe you or a loved one's a candidate now when maybe just a few years ago you weren't, or you just want to know what's going on. My advice, sit back, get comfortable, and I'll see you inside.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back, Mike.
Doc, it's great to see you. Thank you for having me out today.
My pleasure. Let's sit down.
Oh, thank you. I came back, and again, I want to thank you for having me out to discuss what's changed since I first talked to you a few years ago in studio. I was amazed at some of the things that you told me. Obviously, your practice has changed. You're now the Nevada
Institute of Implant Dentistry.
And your practice now is basically just implants.
That's correct.
Other dentists in town send you patients, referral patients. You also do something that is basically a lost art. A lot of people, it's not being done, I guess, because they're called subperiosteal?
Subperiosteal implants.
Single implant. People lost a lot of bone.
That's correct. It's becoming a lost art in the U.S.
Why do you think that is? I mean, now and here's the thing, and I really wanted to talk to you about this too, and I didn't mean to cut you off, but since I spoke to you last, it appears that this market in general, and all across the nation, dentists seem to be growing like wildflowers. And every one of them now seems to be an expert in implant dentistry. They all have, so we do implants. And I laugh because there was a commercial on TV recently, and it showed a couple tennis players. And they were hitting the ball back and forth, and then one fan ran onto the field, and then another one, and pretty soon everybody was on the field, and there were thousands of people, nobody hit the ball, it was just a mess. And the ad said, when everybody plays, nobody wins, meaning that there was really no concise who specializes in stuff. And obviously you do just implants. Why do you think that the subperiosteal is being a lost art? First, explain to me, everybody, what it is.
Your analogy there is very astute, by the way. But I think the subperiosteal implant is becoming a lost art, mostly for monetary reasons, and the second is it's very complicated.
Well, you did say, and I was surprised that one, it's for people basically that have a lot of bone loss, maybe don't have a bone for implants, maybe don't want to have the bone augmentation and go, because that can be painful sometimes. They don't want to go through all that, but they want it. So it's one single implant, one surgery, right?
That's correct.
It wraps and actually holds the bone.
That's right.
And I was surprised to find out that doing that is actually a less expensive way of securing a denture than putting in 4 or 6 or 8 implants.
Right.
But you're telling me it's a much more, is that it? It's much more technically challenging?
It's very technically challenging, yes. And it's for people who, exactly what you say, if there's so much bone loss and we are on the verge of not being able to really graft very well or replace the bone, or we're skeptical about that procedure, and if we were to place traditional root form implants, the jaw would fracture or the person's jaw would break. So then we apply this implant, which actually protects the jaw from breaking.
But there've got to be, and I don't, obviously I've looked it up. There are a lot of people that need that go to a dentist that says that they do implants that are turned away.
Right. Well, what are there? 50 million people in America that are wearing dentures, and people who have been wearing dentures for 10 plus years probably are a candidate for this type of implant.
And with that implant, they don't have to go through the bone augmentation.
No.
What they have is good. When it comes to training, when it comes to, because I talked to you about this, we talked about, you were laughing about what the state of Nevada requires to keep your dental license current, which is
20 credit hours per year.
Right, and you said you can get 8 of those at an outing on a weekend playing golf almost.
That's correct.
You consistently do
300 to 500
hours. Now, is that, do you think, and I know we're going to talk about cutting edge technology, we're going to talk about what's new, we're going to talk about all the things you can do now that just a few years ago were, is that education an integral part of doing that?
Absolutely. I wouldn't want to do what I do without having that extra backbone of of technology, of technique, of knowledge, so that I know exactly what I want in different situations, and I have some depth.
All right, we're going to
what I
talk.
do.
You're a little different in that most dentists, if they don't do implants, have up until recently sent their patients to oral surgeon, a periodontist, somebody that's all they did. And I talked to a couple doctors. You have a lot of dentists in town that refer you patients, and you place the implant, and they do the restorative. They put the teeth on.
Right.
Do you find it? Do the dentists that refer to you? Why do you think they refer to you? And do you think the fact that you understand where the restorative needs to go, so you can place the implant to achieve that, whereas the oral surgeon, a periodontist may not do that. He may just place it where it's optimal position for the implant, which may not be able to be restored, which causes a problem for the referring doctor. Do you think they like the fact that you understand what they're going to be doing?
Well, to me, obviously, the patient's perspective is not the implant, it's to get teeth. So the most important thing about placing an implant is that it looks good, it's aesthetic, it functions well, and the whole system comes together. And being someone who restores implants as well, not only do people send their patients to me, I also restore my own implants, and I have more of a sense of where those implants should be for the permanent or final product.
And you just, and I ask, obviously I've already talked to a couple of people, and we're gonna show those interviews here in a bit.
Mm-hmm.
But they all say that part, that you understand going in where they need to be coming out.
That's correct.
That they get the implant back. And one gentleman I talked to even said that you have on occasions come to his office when it's a little beyond his ability to restore and help them.
That's right.
That's not something you would normally find with, an oral surgeon or a periodontist couldn't even do that. Is that correct?
Well, they're not trained in the restorative aspect. That's more of a prosthodontic standpoint.
Well, I don't mean to be quick and short, but I've got a lot to get to today. I want to see your office. I want to see some of your new technology. So take a moment, if you will, and show me around.
All right, great.
I've been practicing in Las Vegas for over 20 years now. Most of it is comprehensive, restorative, a lot of full mouth cases, a lot of cosmetic items. I've used a few different specialists in town over the years, and you kind of get a feel for a comfort zone and how they treat the patient, not only clinically but also clerically and professionally. I had some doubts at first. I didn't know Dr. Perkins. I wasn't sure if he was at the same caliber. That as I started working more with him, though, I was very pleased with the work that he did. And as I get my patients back from him, it's a lot easier on me than dealing with some of the other specialists I've had in the past. He's the best in town that I can tell you. I said I've dealt with at least another dozen people in town over the last decade. And the part about the full mouth reconstruction, I don't want to focus on that or get too much detail. But there's a lot of people with bite issues, and they've got a lot of pain and headaches and things that is attributed to their bite. I don't blame the dentist directly. They're still doing what they think is best. The dentist, I think, was maybe using a philosophy that I don't agree with. They're using antiquated techniques that, even though the dentist did what they thought was best for their patient, the dentist was just naive. They were just not aware of techniques right now that are better. Travis stays up on things. I was actually impressed by some of the things that he has done with follow-up. I think continuing education is key. Yeah, see Travis for the implants, restorative dentistry, come back and see me, especially if you're looking for cosmetics.
Tell me a little bit about IV sedation dentistry. I know that you offer IV sedation to your patients here, but what is really the difference between IV sedation, conscious sedation, the little blue pill, nitrous? I mean, when we open up a book, a magazine anymore, it's very confusing. What really is IV sedation?
Right. Well, IV sedation is actually where you're connected to an IV proper. And we either bring in an anesthesiologist or I'll do it myself. I prefer to bring in the anesthesiologist so that they can monitor that aspect, keep the patient very comfortable. The patient has no memory of what happened, so that makes it very easy and comfortable and convenient for the patient and also for myself.
So when you say they have no memory, are you telling me that literally they come in, now, because I know people have taken the blue pill, and they have to have somebody drive them there, and they have to have somebody drive them home, and they're kind of woo-wee, but they have a little recollection. You're telling me no recollection?